Morning, my name is Dr. Prerna. My topic for poster presentation is innovative techniques in dealing with difficult laryngeal exposure during microlaryngeal surgery, a case study. Introduction. Microlaryngeal surgery using a direct straight laryngoscope is a widely used surgical procedure. This procedure is a treatment modality of various glottic conditions ranging from a simple vocal cyst to a glottic malignancy. Adequate visualization of the vocal cord, especially the anterior half and the anterior commissure, plays a major role in surgical management of any glottic condition. Incomplete exposure of the vocal cords can lead to insufficient surgical management of the laryngeal pathology and inadvertent tissue injury. The preoperative knowledge of difficult exposure of the glottic plane can alert the surgeon about the need for alternative measurements to be considered. The aim of my study is to understand the various parameters used for difficult laryngeal exposure during microlaryngeal surgery and the mode of management used during such cases. Predictors were modified Malampati score, hyoid mental distance, neck circumference, body mass index, thyroid mental distance, thyroid mandibular angle, horizontal thyroid distance, vertical thyroid distance, interincisor distance, and maximum neck extension. In case 1, we can see a 67-year-old male who came with chief complaint of change in voice since 3 to 4 months. His modified Malampati score was class 3, body mass index was 36.57 kg per meter square, thyroid mental distance was 4 centimeters, thyroid mandibular angle was 124 degrees, and horizontal thyroid distance was 3 centimeters, all of which were an indicator of difficult laryngeal exposure, as we can see in picture 1 and picture 2. In case 2, a 77-year-old male came with a chief complaint of change in voice since 4 months. His modified Malampati score was class 2. Body mass index was 30.2 kg per meter square. Thyroid mental distance was 3.8 centimeters. Thyroid mandibular angle was 122 degrees and horizontal thyroid distance was 2.8 centimeters. Again, all these parameters were giving an indication for difficult laryngeal exposure, as we can see in picture 3 and picture 4. In management, we used Macintosh laryngoscope. As we can see in case 1, the anterior commissure as well as the anterior half of the vocal folds were very nicely visualized, and in case 2 as well as the anterior commissure and the anterior half of the vocal cords were very nicely visualized. Both the hand of the surgeon were free, hence it gave an adequate exposure and a better surgical management as well. Result was using Macintosh laryngoscope helped in better exposure of laryngeal inlet during the procedure. Discussion. In cases of difficult laryngeal exposure cases, both predictors as well as Macintosh laryngoscope played a significant role to predict such cases. Hence, the parameters have significant value, also good operative decision making for the surgeon. Conclusion. Based on our case results, modified Malampati score, body mass index, thyroid mental distance, thyroid mental angle, hyoid horizontal thyroid distance measurements helps in the prediction of a difficult laryngeal exposure preoperatively. These physical parameters can be measured just prior to the surgery with using simple measuring aid. The advantage of preoperative prediction of difficult laryngeal exposure being that it enables the surgeon to be prepared beforehand, as well as using Macintosh laryngoscope gave a far better exposure. Thus, both these parameters had its dual significance while managing such cases. My references were as such. Thank you so very much.